Thank you.
Thank you. We're happy to have you. Hello, Emmanuel. Can you hear me?
Yes, I can hear you. Thank you for having me
Okay.
too.
Yes. Can you go on
Yeah.
with the session?
Okay, thank you. So today I'm here to talk to the world about our main topic, which is mental health in in an, an in an unequal world. As you can see, I do have my PowerPoint presentation, which is there. Thank you, sir. So truly, we do live in an unequal world, and for many, disparities are very clear. People can see the disparities everywhere we go. You know, everywhere we go, we can see the different disparities in this world and how the world is unequal. Some of it is brought by natural activities. Some of it is it's brought by man-made activities, and through this, we can see that there's so much work to be done so as to get the message that mental health is required and it is an important factor of health among us. I wish I could move on to the next slide. Kindly move on to the next slide. Yes, the other slide. Yeah, so thank you. So you will bear with me as I also go through the PowerPoint file. I did not have enough time, but I believe what I have for you is enough, and the conversation that will spark here we will come out with something. So we live in a world which is divided by into multiple stratas through tribe, gender, race, and political ideologies. These divisions are very, they can be seen even as we walk and out there through our daily lives. We can see the different multiple stratas that we are in here. There's also struggle to survive and also to gain power, so that brings there's a competition every day. People are competing against each other, trying to survive, trying to gain power, trying to get financial gains. And with such things brings about unequal, because everyone is thinking about themselves. And through us psychologists, through us mental health champions, we want to bring this inequality. We want to bring it into a small, a straight bar where there's equalities. The one of the global goal that we have is to have equal rights. That's one of the agendas. It's one of the goals that we have in the 2030 sustainability development. We want to attain gender equality, and through this we have to improve the services, the customer services that we do have. We can go to the next file, please, the next slide. Now, as we can see through these diagrams, is that the first diagram, the one on your left, is a diagram it's a diagram by Abraham Maslow. He was a behaviorist, and he studied how human behaved in terms of what they need to survive. And as we can see, the chart starts from the bottom all the way to the top. As human beings, we first need psychological needs, things that satisfy us in our own bringing, like food and sleep. You cannot see sleep, you cannot see how food is digested, but we need these things so as to survive. They're very important. Then number two, after we have had the psychological needs, we need some safety, somewhere where we can call home. This also includes family members, people who you talk to, your support system, which is very, very important. You need to have, we all have places where we live, but most of us cannot call those places home because, excuse me, they probably are not safe, and they probably are alone and they do not have people around them to give them safety, to give them personal safety. And number three, as we go up, if we do get safety, we now get love and belonging. Now we now belong to groups, as a family, the family accepts you. You even get the name. For example, for me, Masinde, we call ourselves the Masindes here in Kenya. That belonging makes you also feel like you have something in you. After getting the love and achieving deeper and meaningful relationships, your self-esteem improves. You now get to know yourself. You now get to know what you do, what you can do, how people perceive you. You now get to acquire skills that makes you recognizable in a particular group. And finally is the self-actualization. Here, this way you get your highest potential. I like using this example, like one of the greatest pop star artists, is Michael Jackson. Michael Jackson achieved self-realization by being a popular pop artist, and a successful pop artist. He's the epitome of pop culture, as it started. And through self-actualization, now you get to know who you are, who you are as a person. And on the right side, there's the wheels of power. As I said, we live in an equal world, and there are a lot of power struggles and need struggles. And this is a diagram by Sylvia Duckworth, which is the wheel of power. It shows how power, privilege, and social identities intersect. As we go towards the center of the circle, you can see there's the power. And as we go outside the circle, we can see what are the least powerful or least privileged people or situations or positions. So as you can see closer to the power, we have, let's say, the rich people are powerful. In terms of body size, people say those who are slim, who are well built, they are powerful. In terms of mental health, if you are able to be robust and be able to change into any environment, you are able to be termed as powerful. And as you can see, as we go outside the circle, we see people become less powerful and less privileged. For example, you can go to the top part of the circle, which says the skin color. People who are dark are actually marginalized, compared to people who are white or skin colored. I know I myself, I'm a dark person, I'm an African, and some of these things, they're very, very, very open. We've seen racial discrimination, which now this in the end brings about poor mental health services and poor mental health care. Yeah, we can go to the next slide, please. So now, after all this, we need to know what health is. And most of the people do not forget that health is not one thing. Health is made up of different factors. And this, according to the World Health Organization, health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. That you can still have flu, you can still have little stress, you're stressed about what you're going to eat this evening. That's not you being unhealthy. But if you're having a complete state of physical, mental, and social well-being, shows that is now the definition of health according to the World Health Organization. And as we move on to the next slide, mental health encompasses different things. You also need to have proper physical health for you to have good mental health. You also need to have proper social health. You also need to have proper environmental health where you live. You know, you need to have a clean area. You need to have less polluted area. You know, you need to have clean water. So mental health and privilege status is that there's a very big disparities with people accessing mental health services, you know. And as I was saying, mental health is an inevitable component of overall health and well-being, and not component of health exists alone, you know. So that in regard to mental health and care treatment, there's a huge difference between the haves and the haves not, you know, the privileged and the underprivileged communities. And I'm not saying that the people who are rich, you know, or come from the rich class do not suffer from mental health issues. They do. But the access to mental health care services, you know, brings now the disparities, bring the gaps between the people who have access or capital to reach these mental health care services, you know. But we're also focusing, currently we're focusing on the underprivileged communities. We're focusing on the marginalized people in this conversation. As we move on to the next slide, please. We can move on to the next slide. Yeah, no, back, kindly back. The previous one, yes. Now, as I was saying, that mental health cannot stand alone. According to the biopsychosocial and spiritual perspective by SAMSI in 2002, is that all these aspects of health do promote in proper mental health services. You know, they say that for you to have good health, you also need to have good social support, which you also need to have good psychological support, according to the diagram on the left, which says that for you to even have good family circumstances, you also need to have good genetic vulnerability. You have to have less genetic vulnerabilities, you know, less drug effects on, you know, and you have to have, let's say, proper coping skills in the psychological area, and also good mental health and improved self-esteem and strong family relations. They, according to this model, some Samase believed that for you to be ill, you have to have, for example, poor family circumstances. You have to have, let's say, you know, you're under under influence of drug, according to the biological aspect. You also have to have less coping skills, poor social skills, which can now, you know, contribute to you having poor mental health. So having proper and a balanced um, perspective on both the biological dimension, social dimension, spiritual dimension, physical dimension, brings about proper mental health. We can move on to the next slide. So we can see that according to this, to what is here in front of you right now, is that both the internal person and what is outside do have a correlation in terms of promoting poor or not poor mental health. You know, for one to have a good interpersonal relations, you know, you have to have good physical relationship of your body parts. You know, you have to have, you know, good you know, working arms. You know, you don't want to have a broken leg. You know, you don't have to have reactions in your body. Number two, you also have to have good mind body relationship, you know, and this talks about mood, talks about emotion, talks about, you know, the personal physical state. And this is related to the extrapersonal, you know, dimension, where the relationship to the physical environment, you know, like as we can see, people who are coming from, you know, places where there have been terrorism, you know, places where there have been natural disasters, you know, like floods, you know, and also, you know, some of these things do contribute to to the general mental health, um, upbringing of a person. The also relationship between family, and the relationship between transcendence. This talks about spirituality, how you relate to, your deity, the one, your God, the one you pray to, and the spiritual or the religious practices that you. So these do affect mental health. We can move on to the next slide. Yeah. So now these are the references. Even though the slide was short, I do believe there's so much to be talked about. I do believe there's so much to be talked about. And I want to say that some of these inequalities, what are the causes? What are the causes of some of these inequalities? I did not able to include, but I'm just going to list them. Some of these inequalities, social defects, perceived loss of control and erosion of social trust. There's also gender. People, there are some communities where the men are empowered by the social political systems that they assign that boys or men are more of leaders, and which leads to toxic masculinity with risks of violence and alcohol and substance abuse, as well as reluctancy in help seeking. So some of these things, also racial discrimination is one of the things that contributes to an unequal world that we live in, which brings about, people unable to access services which are important, like the mental health services. And I want to thank my director Quinta for having enabled to work with other companies and other corporations here in Kenya. Like currently, we are working with a company called Triggerize it's actually a South African company, but then it is also here in Kenya, where we use telecounseling, to reach out people who have less access to such services, and we started this July, and so far so good. We have reached over 50. We call them Rafikis in Kiswahili means friend, Rafiki. Yeah, so they're the clients, we call them Rafikis. So we've been able to reach a good number since we were held down during the August elections. We did have the elections here in Kenya, which were held on August. So we had to stop because of the risk of unlikely where they're going to be, like chaos. But we thank God all went smoothly, and we had a peaceful transition. So some of these factors do really, really, really contribute, to either improving one's mental health or reducing one's mental health. And we have to see what can we do. So what can we do, since now we have these challenges. So number one is we can educate the public. Civic education is very, very important. Civic education is important. People should know what mental health is. People should know what health generally encompasses, what it encompasses. People should know how to go about these types of illnesses, like disorders, mental health disorders, like depression, anxiety, bipolar, schizophrenia. Most people in the society do not have much information about these disorders or these illnesses, mental illnesses. So we can improve that by improving the we can do that by improving the civic education done. And also we also want to look at putting a stand on gender inequalities, by making sure men and both boys and girls participate equally in both men and women, or boys and girls, participate equally in such events. For example, these initiatives, we would like to hear the numbers of men and women, coming to at par. We wouldn't want to have less men and more women. Like where I come from, whenever we have talks in the community, we will see more women, come to these public talks compared to men. Men, shy away, and are very, very reluctant in seeking help. So another point is that we want to the cultural norms, talking about men should not talk, and how they perceive men. So we need to improve how we perceive men in these times of today. People say men are tough, men shouldn't talk, men are, you are the head of the house, so you're the one who should go out. So we also want to reduce these stereotypes that we have, especially the African stereotypes, where about men are strong, men should not talk. Only women, or women should not talk about their problems. They should only talk to their wives. We should break the barriers. Another thing on how we are going to improve this situation, is by improving the government. When the government comes in and they improve the systems, when the government improve their systems, we are able to capture more people from the public, by when the government improves more, and they have more policies on matters of on mental health. This will improve, the services which are needed for people to get those services. So we do have a long way to go, but it is very, very important where we are right now. We can able to communicate. I am so happy you are able to reach out all the way to Kenya and be able to join this wonderful initiative, all the way from Nigeria. So we are very, very, very thankful, and we hope these conversations continue, and we will be happy to be part of this team. I didn't have enough time to compile because, Quinta told me this in abrupt, but I want to say thank you. And I would like to end my talk and my talk there. If there are any questions, I want to open up the floor so that we can have any questions.
Okay, thank you, Emmanuel, for this session. It was interesting, very enlightening, and very, very informative. Thank you so much.
Thank
And
you.
the floor is open for questions. You can ask your questions now. Ask your question in the question and answer box. Ask your questions in the chat box, and Emmanuel will respond to your questions. So before the questions, I learned quite a lot. I learned a new word today in Swahili, friend, right? From you, Emmanuel.
Yes.
Very interesting.
Yes.
Yes.
Yeah, friend is Rafiki.
Yes.
Yeah.
So how can I say friends?
Friends in
Yeah.
plural.
Yes.
Okay, so for in plural, you add an ma. You say marafiki. One is
Oh,
rafiki. Yeah, so if there are many, you say marafiki. Marafiki
okay.
wangu. Wangu is mine. So like now the empowerment, empowering women, for, like the group now is I am Rafiki to the talk, this current talk. Yes.
Okay.
Yeah.
Questions, ask your questions. Our Rafiki is listening and he will respond to them.
I can see the questions are coming in.
Yes, we have some questions. I should read the questions for you. Let me read the first question. Jalilat is asking, how can we help victims that do not know they need help?
Okay, pardon, how? Come again, please. Kindly come
Okay,
again.
sorry, Emmanuel. Yes, the question is women's role. What are the roles of women in improving mental health of their children?
The role in women.
Of
Role
women in
role of
improving
women.
mental health, yes, of their children.
Okay, so the role of women is actually important, especially in the case of a mother and a daughter, or a son, where the mother is a caregiver, and this is primarily, where everything begins. The child, learns a lot from the caregiver. So however, whichever way the mother behaves, so the child is picking up through observation. So mothers are very, 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 very crucial and important in upbringing children. Women, women teach their children some things which men cannot teach. The same way men can teach their children what women cannot teach their children.
Okay,
Yes.
thank you for the response. Joy is asking, what is the role of women against mental health in an unequal world? Against mental health problem in an unequal world.
Okay, so the role of women against the mental health problem in an unequal world. So, as we all know, men and women are both game changers, in the mental health conversation. The conversation cannot be one-sided. It cannot be men alone or women alone, because mental health is somehow affects everyone. A very good example is, for example, people who have committed suicide do affect their friends. And you cannot say it's because he was male, so he only affects male, or because he was a woman, so he only affects the women. No, the role of women is very important in the mental health because it all affects us. Mental health is not a thing for one gender. It's a thing for everyone, and it begins from the right time you're born to the right time you grow old.
Okay, we have another question from Jeremiah.
Good afternoon, everyone.
Yes. Good afternoon.
Hello.
Hello.
Hello. Yes. We have Dr. Okechukwu's hands up. He has something to say.
Not quite.
Okay.
Yeah.
Okay, then we'll continue with our questions. Okay, we have another question from Jeremiah. How do we provide more access and awareness of the people in developing countries, especially in Africa, to mental health?
Okay. How do we provide more access and awareness?
Yes.
Okay, so here in Kenya, locally, what we do is one, we need, especially for African countries, especially here in Kenya, the most important thing is the reduction of stigma. There's a lot of stigma when one tries to access mental health care services. There's a lot of stigma, especially for men and also women. Whenever a man says, I am stressed, I want to talk to a psychologist, a man is easily put down and easily seen as weak. So number one is reducing stigma, especially in African countries. There's a lot of stigma with counseling services and getting mental health services. So another point is also in the now educating the masses. We need to educate the masses on the importance of receiving such healthcare. A lot of people do not know that you can go and see a psychologist in hospitals. They do not know about that. They only think hospitals are only for the body, physiological problems. So if we get enough education and enough people to be aware of the services and where they can get them, we can be able to improve the mental health care among African countries.
Okay.
Yes.
Doda is asking a question. If I understand the question correctly, he's asking if psychological needs is a basic need for a man to live.
Okay, so he's asking is if psychological needs are basic for a man to live. Okay, according to Abraham Maslow's hierarchy of needs, which was among my slides, it shows that psychological needs is the basic need. You need food, you need water, you need sleep. If you don't eat properly, three meals a day, if you don't have enough water, they say you have to drink 8 glasses a day. If you don't have enough sleep, they say you need to sleep 6 to 8 hours, for you to have proper sleep. You are definitely not going to have time, for even to love people. You're not going to have time to love yourself. You're not going to have time to make yourself clean. So it is very, very important for a man to live with the psychological needs. I'm pretty sure you cannot live without eating, right?
Yes.
Yes. So psychological needs are very, very important for you to climb up the hierarchy, of the needs. You need to know how to feed yourself properly, then have a good home, then get someone you call, a girlfriend or a boyfriend, then it improves your self-esteem, then you actually self-actualize what you can do. Yes.
Okay, thank you. We have another question from Jeremiah.
Okay.
While fighting against the stigma, have you seen a visible difference in the people's attitude as regards Kenya now as a case study?
Yes, I've seen there's a visible difference in people's attitude, and it cuts across, different racial groups, different ethnical groups, different ages, and stigma is seen. For example, older people might have the stigma of wanting to access mental health services. Unlike young people can easily talk to people and open up. Older people might find it hard to talk about their problems, and look for mental health care services. And in Kenya, we can talk about people in different geographical areas. People in the urban areas, might have a lot of pressure, seeking mental health care services, and also same applies to people in the rural areas, where there are less services, there are less mental health care services. So there's a visible difference between the attitudes, of in Kenya regarding stigma. In the in the cities there's less of stigma, but also high stigma. You know, it's a very difficult issue right now. But you know, I believe where there is smoke, you know, there's fire. So we're talking about it. So definitely we are heading on the right direction.
Okay, thank you, Emmanuel.
Yes.
Yes, you can still ask your questions.
Yes.
Ask your questions and your comments. Don't forget, you can still go to the Woover app and ask your questions there. You can still link with your speaker on the Woover app. You can still connect with your speaker on the Woover app. Don't forget. Okay, so I can see that this session was really interesting and we do not have much questions. But Emmanuel, I noticed your video has been off all through. Would like to have a group photo with you, but before the group photo, would
Okay.
like to, yes.
Sorry to cut you. I tried to open my camera to start my video, but it says you cannot start your video because the host has stopped it. I've been trying to turn it on. Thank you.
Oh, yes, so we can see you now. So
Yeah.
thank you so much for this session. Thank you so much for this session. It was an
Yeah.
interesting one. It
Yes.
was informative. We learned a lot. Thank you so much. Thank you, our friend. I've forgotten that
Rafiki.
line. I've forgotten that
Rafiki.
line. Thank you so much. Yes, thank you, our friend. Thank you, Rafiki.
Yeah.
Thank you. It was interesting.
Yes.
And don't forget, like I said earlier, you can always connect with our speaker on the Woover app. We have the poll up. Ensure to give us your feedbacks. They are very important to us. Ensure to give us your feedbacks. Respond to the poll on your screen. We'll also not forget to thank our participants. Thank you for staying tuned. Thank you for staying from the hour we started till this very time. Thank you so much. But we'll be having the last session for today in 30 minutes time. So you have 30 minutes to rest and then we'll come back for the last session. Thank you so much to everybody that's been on the call. Thank you so much to those that have been following on Facebook and on other social media platforms. Thank you to those that have been following on Woover. Thank you, and thank you. This was indeed a wonderful session. Thank you, everybody. Don't forget to respond to the poll before you take a break. The break is just for 30 minutes and we'll be back again. Don't forget to take the poll before you go for the break. Thank you so much. Thank you for your wonderful comments.
Thank you for having me.
Okay, thank you.
Everywhere I turn to, I walk to the.
Thank you, Emmanuel. If you can hear me before you leave, we'll be having the group picture with you.
Yes, please.
Okay, yes. Can we have our videos on? Okay, thank you so much. Thank you, everybody. Our next session begins in 30 minutes.
Mother.